Hello everyone, thank you for coming to my talk this evening. My name is Garrett Davis and I am a sophomore microbiology major in the Randall Research Scholars Program. This semester I've been working with Dr. Kumar in the Center for Convergent Bioscience and Medicine, and my research focuses on improving oral drug efficacy through nanoparticle formulations. So a bit of an overview of what I'm going to be talking about tonight. I'm going to start with a problem, and that is the toxic side effects and the high concentrations associated with typical oral drugs. Next, I'm going to get into the methods we use to address these problems, and that is through nanoparticles. Next, I'll get into the goals of our research, what effect do we want to see on the body of the patient when these nanoparticles are introduced, and what effect do we want to see in the overall change of the quality of life of the patient. Finally, I'll get into future directions for our project and my research in particular. So a bit of an overview. There are several biological barriers in your body that are designed to keep foreign objects out. These work great for keeping out bacteria and viruses that would seek to cause the body harm, but they work just as great for keeping out drugs that we want to get into the body. The most common is the skin barrier. The skin barrier is a non-selective barrier that will keep anything and everything out. Any drug that we want to get into the tissue of the body has to find a way around the skin barrier. The most typical routes are through injection and oral routes. We've chosen to focus on the oral route because it provides the best quality of life for the patient. You don't have to worry about the pain associated with the needle or the risk of infection with an injection site. Unfortunately, with the oral route, you run into two new biological barriers. The first is the stomach. The stomach is a very low pH of around 2, which means it's highly acidic and it will attack and degrade anything that comes across it. So when you take a drug and it enters your stomach, the stomach acid will begin to immediately attack and degrade the drug. When a drug is degraded, that means the physical form has changed and it can no longer function to have its desired effect on the tissue in the body. It'll pass through without ever fixing the reason you took the drug in the first place. Not all of the drug will be degraded, and what does survive the trip through the stomach will pass into the gut, where, this is the intestines, where it will face the second biological barrier, and that is the gut wall. The gut wall is a highly selective barrier that allows some molecules through, but most it will not. The gut wall is looking for organic molecules that the body needs for its typical biological functions, such as lipids, fats, or proteins. What it's not looking for is a drug that was made in the lab that the body's never encountered before. We know that the drug has a beneficial effect for the body, but the gut wall does not know that, and therefore it won't let it through. This means that out of all the drug that survives the trip through the stomach, a lot of it won't be able to pass into the tissue because the gut wall will deny it, and it will be secreted without ever reaching the target tissue. So how do we go about fixing these problems? We use nanoparticles. This is a polymer unit. It's the basic subunit for a nanoparticle, and a bunch of these make up the nanoparticle itself. This is the nanoparticle itself. In real life, it's a sphere, and the circles you can see on the inside are drug units encapsulated within that sphere. When you combine nanoparticles and drugs, they form this sphere with formula units poking on the outside. There are several benefits to this design. The first is that hydrophobic interactions cause polymers to form a sphere with the drug distributed within. What this means is that when you take these nanoparticle formulations, the outside is entirely polymer, and the inside is where the drug is. So when it goes into your stomach, the acid will only interact with the outside, the polymer, and the drug will remain on the inside of the sphere unharmed. It will pass through the stomach without ever getting degraded. Once it passes through the stomach, it'll go into the intestine, where the second benefit comes into play, and that is the formula groups that are protruding from the outside of the sphere. These formula groups can be modified in order to mimic an organic molecule that the gut wall recognizes and wants to let through. This takes your affinity for the gut wall from low to high, meaning all of your drug that survives the trip through the stomach will pass through the gut wall into the tissue rather than being secreted. This is what that would look like in practice. This is a non-formulated drug with no nanoparticles. As you can see, a lot of it's in the intestine. Some of it's trying to associate with the gut wall, and only a small amount has passed through. We would expect most of this drug to get secreted without ever making it into the tissue. This is the nanoparticle formulation. As you can see, most of it's trying to associate with the gut wall. A large majority of it's passed through, and we would expect almost all of it to pass through the gut wall into the tissue. This is the effect we hope to have on the patient's life. On the left is a graph that represents a dosing schedule for a non-formulated, no nanoparticle drug. On the right is the dosing schedule for a nanoparticle. This red line is the maximum tolerated dose. This means that once the concentration in the body goes above this red line, you'll start to have toxic side effects. This can be a headache, nerve damage, kidney death. It all depends on the drug you're taking. The goal is to stay below this red line, but due to the fact that the stomach is degrading the drug constantly, and not all of it's making through the gut wall and being secreted, when you take a normal drug, the drug levels are constantly decreasing in the body as these biological barriers act on them. This means you need to take a much higher initial concentration than what you want to see in a tissue which is why you see these peaks going above the maximum tolerated dose. When this happens, you get a fresh set of symptoms, and as I mentioned, the biological barriers will begin to degrade the drug in the body and remove it, which is why you see this drop in concentration. Eventually, you'll fall below the green line, which is the minimum effective concentration. Below this level, the drug has no effect on the body, and you have to redose. You get a fresh set of symptoms. Levels begin to drop in the body. You have to redose, and the cycle continues throughout the lifespan of the drug. On the right here is the graph with nanoparticles. Now, we know that all of the drug will survive the trip through the stomach, and almost all of it will pass through the gut wall. This means we can take a much lower initial concentration versus what we want to see in the tissue. By doing this, we can stay below the maximum tolerated dose and avoid any of the symptoms associated with that. And since all the drug is passing through the tissue, very little of it will get secreted. Drug levels will remain high throughout the half-life of the drug. What this would look like is taking 1 pill a day with breakfast in terms of nanoparticle formulations and having little to no side effects with that pill versus taking multiple pills throughout the day for a non-formulated drug and having a fresh set of adverse symptoms each time you take the pill. This is the compound I specifically work with. This is curcumin. It's a potent antioxidant, anti-inflammatory, and it can be used to treat arthritis. It has very little side effects, but unfortunately, it has almost no affinity for the gut wall. So no matter how much you take, you won't see a very high level in the tissue. I've been working on nanoparticle formulations that increase the affinity of this drug with the gut wall, and recently I finished nanoparticle formulations, which is what you see in this glass vial. We've made about 150 of these glass vials. And right now we're doing drug analysis, which is using a scanning electron microscope and other machines to see how much of each drug is in the nanoparticle, see if the nanoparticles are bonded correctly, and get them prepared for dosage in the clinical trial, which is coming up. The clinical trial will test the effect of the nanoparticles in the drug in a real-life animal model, which is we're using mice because they represent the mammal intestine system very well. And we'll have 4 groups. We'll have control group, no drug, no nanoparticles, we'll have drug and nanoparticles, and then we will have nanoparticles by themselves to test the effect of nanoparticles, make sure there's no toxic side effects, not attributed to the drug, attributed to the nanoparticles themselves. This trial will take about 3 months, and then we'll write a paper and conclude this project. That's all for my research so far. I want to say special thanks to Dr. Kumar and Dr. Aurora for taking me into their lab, as well as the National Institute of Health for funding our research. With that, I'll open it up to questions.
What changes do you make to the formula groups to encourage interaction of the nanoparticle with the gut wall?
Good question. The gut wall is covered in receptors. That's what controls exactly what goes through the gut wall from the intestine. And we stick a gambogic acid on the formula group, which is something that interacts with these receptors. It's what mimics the organic molecule itself, and that's what directly increases your affinity.
What do you do to make these nanoparticles form into spheres and ensure that the drug is on the inside?
So the nice part about the nanoparticles is those hydrophobic interactions I mentioned earlier. There's polar and nonpolar molecules. They interact with each other, but they don't interact in between, so polar will not interact with nonpolar. When you mix, the nanoparticles are nonpolar, and the drug itself is nonpolar. So when you mix them two in a polar formula, all the polar molecules will go together and try to avoid the nonpolar solvent, which means that naturally they will form those spheres. And as long as you make the conditions right, they'll do the work themselves, form the spheres themselves, and then you can just remove the polar solvent and you're left with the spheres.
Can you use formulations like this on any type of drug, or is it only specific to the one you're working on?
You can. We use many drugs. We use insulin, we use curcumin, but the drug has to be nonpolar, so you can have those hydrophobic interactions. And also, the main benefit of the nanoparticles is that they have increased the affinity for the gut wall. So if you have a drug that already has a high affinity, you won't see as much benefit to using nanoparticles.
Thanks, Garrett.
Thank you.